Our first session is about dentistry careers. So we have Joy Brack, and she is a registered dental assistant and dental assistant instructor with the Fade Institute. Then we'll hear from Lindsay Pinckard, and she is a registered dental hygienist and dental hygiene instructor with Carrington College. And finally, we have Dr. Ken Fatz, and he is a doctor of dental surgery in private practice here in Sacramento. Remember to type your questions in the chat throughout, and we'll take a few minutes after all of the panelists have had a chance to speak to go over your questions. And if we have time, I have a little fun dental quiz for you, and maybe the speakers can hang out for that quiz and help me out with some of the answers, because obviously I don't know all that much about dentistry, but I'm hoping to learn with you all today. So Joy, I believe that you are up first.
Awesome. Hi, everybody. Welcome. I'm excited to talk with you guys and kind of give you an insight on dental assisting. So at any time, please ask away questions, because that's how you get all the knowledge and information that you are needing and seeking. So first, I just like to say, awesome that you guys are taking this first step to even get yourself familiar with different careers out there. I have been working in dental for about 16 years now, which is crazy to think. Time flies when you're having fun, right, doctor? So with that being said, I have worked in general practice, which is, I'm sure you guys are all familiar, having your regular exams, coming in every 6 months typically is the average. And along with that, I had some experience in a perio office. So I worked there for a couple years. It's really just, as far as perio goes, it's basically an understanding is dealing with the supportive tissues of the teeth. So they do a lot of surgeries, they do implants, they do more of supporting, more frequent cleanings if needed. So, basically the doctor sees them every about 3 to 4 months. So I also worked there. I also worked in another general practice, and I helped a doctor start with one practice and then open up to 3 different practices. So I helped train some of the assistants and just was the wingman with him. So from there, I probably practiced for about 6 years in the field, and then came across a teaching opportunity, and it's been ongoing since. I've been in education for about 10 years now, which is crazy to think. So definitely have seen, some different practices, worked with different doctors. Really what it comes down to as far as the position, dental assistants, your main focus obviously is your patients, right? Making sure that they feel comfortable, making sure that your team works well. We work very close with our doctors, hygiene, front office if you'd like. There's so many different areas that you can venture into. So for me, I always say to my students, this is the best way to get into the dental field. Start as a dental assistant, work your way, see if there's something that intrigues you as far as maybe specialty. Maybe you really enjoy working with just kids. There's offices, you can work in a pedo office. If your passion is surgery, you really like that medical aspect, there's also that in dental. But really just having the heart and the passion for where you're going is where you're going to excel. So, so with that, some different roles, obviously starting out unlicensed, a dental assistant is what is your term. You're unlicensed. There are some things that you do have to accomplish working in the field. So you do have to be BLS certified. You do have to have, not necessarily, but obviously your doctor wants you to take x-rays so you can take your radiation safety course. Also with your Infection Control and Dental Practice Act. So with those two, we definitely need to make sure we're keeping ourselves safe and also our patients. So watching our infection control is really, really big. So once you've accomplished those courses and you do that within 120 days, you're able to work front office, back office. There are some functions that you still have to stay, obviously, with. We have to stay in our scope of practice. So our RDA, which is registered dental assistant, is something that you can work your way up to. And along with that, there's 2 different ways. You can actually go through a dental board approved program, which is something that we offer, that I teach. So if you're close to El Dorado, I'd love to see you. Come up and visit our campus, give us a call, and maybe come check it out. I'm a visual person, so maybe you just want to see what this really entails and get some good information from somebody here on campus. You're always welcome. And once again, my name's Joy. You can call and ask, and we can set up a tour. So with that being said, going through an RDA program, it has to be board approved. If not, then your experience in the field, and then also your time in your program can count for each other. So there has to be a certain time frame, and then after you reach that time frame and the course is needed, then you can actually sit for your boards. And it used to be a 3-part exam. They actually changed that. It's now only 1 written exam that you do, and you go to a testing facility. Before that, there was a practical portion, but they actually suspended that. So that's really nice. There's no better time than now. You can actually get your RDA license, take 1 written exam, and now you're able to do more functions. Okay, so more functions make you more valuable in your office, right? I see somebody asking if there's any job shadowing opportunities. Yes, and I'm sure Doctor can speak on behalf as well. If there's something as far as shadowing, let us know, give us a call. We can set you up with an office that we work closely with. And that way you're also safe while you're in there. And you get some good feedback from everything that's going on in the office, front office, back office, everybody's titles, and how well we work together to make sure our patients are taken care of every day. So with that, yes, you can always take my email down. I can put that in the chat box after. You guys can email me, and hope I can help you on the side as well. So with that being said, there's, like I said, 2 pathways. You can definitely start as your dental assistant and then become licensed as an RDA, which is registered dental assistant. Okay. So from there, you can actually get more certifications if you decide to do specialty. Maybe you love ortho. You definitely build such a rapport with your patients. You see them very often. So having that assistant that just makes you feel like family is so strong. If you have that personal skill, it really does help you connect with your patients. So other than that, there's lots of different areas that you can move forward into. There's just a few here that I wrote down for you guys to hear about is obviously your general practice, which you guys are hopefully familiar with, going and seeing your dentist every 6 months. We have orthodontics, which deals with correction of the teeth, the malocclusions. Okay. We have periodontics, which is dealing with the supporting structures of the teeth. That's a little bit more on the surgical, if that's something that you're looking into. We have endodontics, which is dealing with just root canal therapy. So your routine, your schedule with your patients is very repetitive, which sometimes, that is something that you excel in. Sometimes it's nice to know that you do, a procedure and you can get very fast, good skills in it. Also oral surgery. If you like that medical aspect, there is maxillofacial surgeons. There's all kinds of areas that you can do oral surgery. And sometimes that can either be in a regular office setting, a dental practice, or it could be hospital setting. So then you kind of enjoy both worlds, medical and dental. For those of you that say, I don't like saliva, which I have. I've had students enroll and come to me and say, you know what, Ms. Brock, I realized I can't do saliva. There is a place for everyone. So with that, I had a student once tell me that, and I had her shadow a lab technician, and they are the ones that actually make all of the crowns, the veneers, dentures, and she fell in love with it. And still to this day, she's still working there. So if you're open and you're asking questions, there is a place for you. Along with that, kind of a small niche, but really interesting is forensics. So forensics is getting very big. Obviously, I don't know too much. I never went as far as forensics, but you can identify a person a lot by their teeth. They say it's like your fingerprints, and with more and more crimes that are going on, they're able to actually figure out some of these cases due to impressions from the teeth. So kind of interesting, kind of opens your mind in a different direction if that's what you're going for. So as far as the dental assisting positions, is there any questions that you guys might have pertaining to the job that you have that you would like to ask before I continue? As far as age goes, we ask for the high school diploma, and that's it. So if you are 17, transition, that's totally fine. We just ask for your high school diploma. Okay.
What about for job shadowing though? Do they have to be
No,
a certain age for that? Okay.
No, not at all. As long as we consent with you, and obviously you have your guardian consent that you're able to be at that office, that's all we need. Okay. Any other questions anybody might have? Okay. So like I was explaining, I do work at the Fade Institute, and as far as the dental that we provide here, I kind of explained just a little bit ago, we have two different pathways, either the work experience pathway, or you can actually go through a board approved program. So we offer both. So our program is about 10 months. So it's nice to know that you can get in, start working. It takes about 10 months to go through. I cannot fill the amount of positions we're getting right now. There's been a huge demand for dental, and I'm sure both of the other, the hygienist and doctor that's on here as well can reiterate what I'm explaining. With COVID and everything that has happened, we have had a huge shortage. We've had, I know, hygienists retiring early, which is creating a demand for hygiene. Assistants, doctors just needing the assistants to be there in office. So as far as the job in itself, the career, it's definitely open and out there for you. And, you know, depending on the office, it makes it really nice. You can have an office if you want that nice 4-day, maybe Fridays off family job, they're out there. If you want that office that keeps you busy because you're a busybody, there's offices that are open 6 days. So it really just depends on you and what you're looking for. And also meshing and connecting with your office. It's definitely a family. So you build that rapport with your patients. I know for me, that was my favorite part. And that's why I'm still to this day so passionate about dental, is because I had the best patients. And when you can take somebody that has fears and phobias and turn it into an enjoyment, when you turn it into, you know, laughter and making your patient feel comfortable, and you keep seeing them and building rapport with them and seeing their families grow, it's the best rewarding feeling. And yes, that's why I'm still in it and I still teach it. So other than that, there's lots of areas like I explained. Definitely want to do something that you excel in and you're passionate about. Okay, because that's where you're going to go far. So with that being said, that's pretty much all I kind of wanted to speak with you guys on, kind of give you some of my background and the opportunities out there for you. And just knowing that you have a resource, if you're still curious, if there's, you know, questions you still have, we're here. This is one thing about our institute, is just being a resource for the dental assisting community. There's not too many, and the dental board is really hard to get a hold of. They're like the DMV. So, so any kind of connection is always good for you guys to have. A little bit about the institute as well. Donna Klein, she actually owns this institute and is very, very connected. She has in the past sat a part of the dental board and wrote a lot of regulations on what we're allowed to do function wise and what we're not allowed to do in our scope of practice. So she's great to speak with as well. So I just want to say thank you, and let me just kind of talk with you and hopefully spark a little interest in dental for you. Once again, hey, there's no better way. Go through dental assisting school, see what's out there. If you want to keep going further, reach for the stars, keep your education going, maybe go on to hygiene, or maybe go on to an EF, which is extended functions. Then that's something that you can do. I've had also students that say they want to become dentists and keep going, but it's just a really good stepping stool to just start, get a feel for the dental community and see where it takes you. So I never thought I'd be teaching, but here I am. So other than that, once again, thank you guys. And if you have any questions, please put it in the chat, and I'd love to talk with you and hopefully answer some questions you might have.
Great, thank you, Joy. So again, students, put your questions in the chat, and we'll ask all of the panelists at the end. We'll have a question and answer session. Joy, don't forget to put your email in the chat as well, so the students can reach out to you. All right, so Lindsay. Hi, Lindsay. I believe you are next.
Hi, thank you. Hi, everybody. I am really happy that I got invited to talk to you all. Lindsay, can I share my screen? I had to log in on a different device here.
You should be able to, Sam. There you go.
Okay, here we go. All right, so just because I'm a visual person, I wanted to share some, some slides and stuff to kind of show you a little bit more about hygiene and what it entails. And I love what Joy was talking about, the collaboration. Like, you get to work a lot as a team and a family when you're in the dental field. So just being able to work with your assistants and work with your doctor, it's really, and with your patients, it's just an enjoyable position if you like working with other people. So as hygienists, right, you probably are aware, like, you go to the dentist and they sit there and they scrape your teeth, right? But as a hygienist, you're so much more than just, a tooth scraper, right? You're an actual healthcare provider. Anybody in that practice is a healthcare provider, right? Our focus is to prevent disease, right? So we help our patients in their efforts to maintain and keep their teeth their whole life. And it's a real possibility, right? To keep your teeth your whole life. And I love it. I had a 103-year-old patient, every single tooth in her mouth, and it was great. I loved working with her, right? Very spunky, sweet old lady. And she, just as a hygienist, right? You get to work with your patients, you get to educate your patients, you are kind of helping them in all aspects of their medical situation, per se. You are checking their vitals, right? You're going to be taking blood pressure, you're going to be reviewing a medical history. You want to make sure that they're healthy enough to sit in your chair, no matter what procedure they're doing that day, whether that's with you, with the doctor, whatever they're doing. We're kind of a stepping stone in making sure that the patients are healthy. And a lot of times, right, you might see your dentist more than you see your medical doctor, right? So it's really important that we're taking those blood pressure readings, because we care about our patients, right? So again, this dental field, just going with what Joy was saying, is just really patient oriented. You get to focus on treating our patients and working with them and making their experience really enjoyable. Throughout the appointment, right, every time you see your patient, you also get to perform, some oral cancer screenings, okay, and work along with the doctor, and hopefully never finding anything, but, if there is something, finding it early. It's been reported throughout the years about 53,000 people get oral cancer each year. So it's quite a few. And the earlier you catch it, the better the prognosis. So it's really important that we're taking into account that we're not just teeth scrapers, right? Yes, that is a very fun, enjoyable part of the job, but we're taking an overall approach to our patients' medical well-being. So you do other things like nutritional counseling, tobacco cessation. You get to educate them with, like, how do they brush, right? You really get to sit there and show them how to brush their teeth, and it's kind of fun, especially with the little kids. Same opportunities with like assisting. You can work in a pedo office, you can work in a perio office, you can work in just a general practitioner's office. So there's a lot of avenues you can take with hygiene as well. And overall, we just help prevent and treat disease and make sure our patients are healthy. Okay, so just like a typical day, if you're working in practice, okay, as a dental hygienist, you're going to bring your patient back, right? And from the minute you lay your eyes on them, you're looking at them, making sure that they are walking and able to move okay. And you do an adequate health history check. You're taking their vitals. And then you get to do an extra oral exam. Okay, so you can see that picture there. She's not in the mouth yet. She's kind of feeling around the chin and just getting a good look at the overall well-being, right? Checking lymph nodes, making sure that there's nothing suspicious going on. Okay, we also take assessments intraorally. Okay, before we even pick up the teeth scrapers, we're just checking the health of the gums. And you can see in this middle picture here, this instrument is used to measure this little pocket that sits around the teeth. And we want that pocket to be really shallow. And what this instrument is dropping really deep, showing us that there is some sort of area of concern in this area. So we're taking an assessment, a full assessment of our patient's gingival health. Okay. And then we have our treatment procedures, which you guys are probably aware of, right? You go in and the clinician will scrape at your teeth. Okay. We're removing bacteria and biofilm and build up tartar, calculus, things like that. So it's really exciting. I have a couple more pictures that we'll go through to show how that works and what entails that. Okay. And it's really nice because you get to work hand in hand, right? You're working hand in hand with your colleagues, right? The assistants in the office, with the dentist in the office. And it's a fun family environment to work together. Okay, so one of the things that you could do is provide what's called a prophylaxis. This is kind of like your standard cleaning for a healthy, maybe some slight inflammation going on. So you can see these pictures up here on the right side. We have a nice healthy, the gums are nice and healthy, right? There's no puffiness, there's no bleeding going on. But then the pictures in the middle and on the left, we have some inflammation going on. Okay, some bleeding, some tenderness. You get to work with all types of patients and you get to help them, right? When patients' gums are bleeding, it kind of sets off these red flags and you get to sit there and discuss with them how to treat them, okay? Because any inflammation, no matter how big or how small, right, it's not good for our bodies. So we really get to focus on patient education and you get to be educators, right? You're a medical professional sitting there educating your patients and helping them on their journey to health. So that's really exciting too. Okay, another thing you can do, this one is a little bit, it breaks our hearts to see patients who have some infection and some disease going on. But at the same time, it's a little bit fun. If you like to pick at things, if you find yourself just, being a picker, you pick at whatever you're holding in your hand, maybe hygiene's the route for you because we get to pick at teeth. You get to remove buildup on the teeth. Okay, you probably heard of tartar before. That's that hardened plaque. You can kind of see it along the gum line here. You can see this yellowed calculus or tartar right along the gum line. Okay, so this is what it can look like. This is pretty severe, but this is what it can look like when somebody has active disease going on and a lot of buildup on their teeth leading to that disease. So in these cases, they have a lot of bone loss present, inflammation, maybe they have some pus coming out of their gums, some mobility, okay, and a lot of bleeding is usually present with these cases. So if you enjoy picking at things and removing and making smooth, maybe this is for you because I enjoy it and most hygienists enjoy it. It's very sad because we want our patients to be healthy, but we get to help them in the process to hopefully stabilize their condition that they have. Okay, here's just another image. So another thing we get to do is take some radiographs, right, and work on a different, instead of just viewing the teeth visibly like the last images, you get to take some radiographs. So on the left side here, we have some health going on. Okay, we have bone that surrounds the teeth and it looks really tall, versus on the right side here, here's our bone levels that have dropped. Okay, so just compare and contrast these two images. And I've seen quite a few patients who have this amount of bone loss going on, and these teeth are very mobile, and unfortunately their prognosis isn't as good to keep them for the long term. So ideally, right, we're disease preventers, right? Prevention is our goal. And so when we see patients who have nice, healthy gums, we are still educating to help prevent anything from progressing. Okay, another avenue is just periodontal maintenance. We could work and stabilize and maintain the infection that we treated. So we treated the infection on like the last images, and now the patient did great with their home care. They're kept brushing and flossing, and they came back to see you for their cleanings regularly. And now things look great, but we just have some bone loss going on. Okay, so you can see on the images here how the gums are a little bit lower than they should be. So this is another avenue with our patients. We get to just maintain their stability and make sure that they are not going back to infection again. So a few things we get to do, but still fun and exciting. So yes, you're going to be scraping teeth, but you're also going to be help educating and maintaining and just keeping disease at bay. Let's see. There we go. Okay, so here's just some more images I thought would be fun to throw in. One thing we do is we get to look and help with the doctor when we take the radiographs. We're going to be helping look for carious lesions. Okay, we're also going to be looking for bone loss. Okay, so you can see here how this tooth's kind of dark and shadowed. So that's never good, right? We want this nice white healthy bone. You get to take some panoramic images to get a look at all of the teeth and kind of get an overall perspective. So that's another avenue. Yes, you're going to be cleaning the teeth, but you're also going to be taking some images as well, which is fun. And you get to do that as an assistant too, which is really nice. So pretty much any avenue of dentistry, you're going to be taking some images. Okay, other things you can do, okay, you can administer local anesthesia if you get certified. So that's always fun and exciting. You get to give shots to people. You can administer nitrous oxide. Again, you need to be certified, but most dental hygiene programs provide both of these certificates throughout the program. You can use things like the ultrasonic if you've ever had that water instrument used on you. That's always fun to learn. Provide fluoride treatments, okay, whitening therapies, and then you can even help, again, going along with the oral cancer screening. So you did an outside exam, but you can also take a look within the mouth and detect for oral cancer that way. You can help, again, if somebody has a condition on their medical history, you can correlate that with maybe an increased risk for cancer. So there's a lot of science and medical history that goes along with this as well. Okay, just some more avenues that you get to learn, right? You get to talk about different conditions that occur in the mouth, okay, patient education. You get to learn a lot of anatomy terms, and we're really just focused on the head and neck. And then you, again, are working hand in hand with the doctor in diagnosing carious lesions as well, okay? Because you spend the majority of the time with the patient, okay? And so it's really helpful to work hand in hand with the doctor, okay, to, oh, I see the suspicious area, what do you think, kind of thing with the doctor. That way it's, 4 eyes, right, are better than 2. And it's just great to have that collaboration and teamwork. So some benefits, okay, being a hygienist has a lot of benefits. Your working hours, pretty similar to like the assistant. You can kind of pick if you want to be full-time or part-time. A lot of hygienists, like they were saying, there's a shortage right now of dental professionals because of the COVID. A lot of people are retiring early. A lot of people just didn't want to come back because of COVID, different things. The nice thing though is when COVID hit, the dental profession didn't change much. Okay, we were still wearing full PPE, we were still burying everything, washing our hands properly. So it didn't it didn't change much. So you get to choose your hours, okay, full-time, part-time. A lot of the time, if you want to work full-time, you may need to work for multiple offices, which can be fun because you get a different experience at different offices. The salary ranges depends on where you live, but the pay is pretty good. And then you, depending on, again, where you work and how much you work, you can get paid time off, you can get dental care, medical benefits. So that just depends on how much and where you work. It's great because, again, you get to work with the patients, build those connections, work one-on-one. I mean, you're sitting in a very close comfort range, right, with your patients, and it can make some people uncomfortable. So as it was said earlier, it's really nice to take those anxious patients and give them a positive experience. And you can also, there's a lot of avenues with this as well. You can work in public health, you can work in a private practice, you can work for insurance companies, sales, teaching. You can even do more extended functions similar to the assistants. You can become an RDH, an advanced practitioner, and that's where you can go out and work, not so much in a practice, but work in care homes and things like that under your own licensure, still in conjunction with a dentist. Okay, there are some challenges though. I don't want to, just float that it's all sunflowers and daisies, right? A lot of people in the dental profession do have a lot of back pain, neck pain, if they're not following proper ergonomics, which is just the way you're sitting, your posture, everything like that. So you learn all of that in school, right? In your programs, it's just maintaining it outside in the workforce. That's where it kind of gets lost, okay? School can be a little bit costly, but there are usually, there can be scholarships, there can be loans, okay? So it is totally possible, but the nice thing is that your compensation after you graduate is usually pretty good, okay? Again, going along with the saliva, if you don't like saliva, it can be a little bit challenging. Same thing with blood. If you don't like blood, it is part of the field because of just the natural environment, right? You're treating disease, so it does tend to be a little bit bloody sometimes. Patient interactions, if you're one person who has a really hard time dealing with people, it's a great learning avenue, okay? Overcoming that challenge is wonderful because there is just something really special about helping patients and working with them. And then boards, similar to getting your RDH, you need to take some exams. So there are a few boards exams that are necessary in order to get your licensure to be a RDH. All right, overall though, dental hygiene, very rewarding. You get to work with people. It can be fast paced, but you could, again, it depends on the office you work in. It works, you may be in an office that's a little bit more slow paced or a fast pace. There's a variety out there. The pay is really great. And just overall, it's just really rewarding. I love the family aspect of being in the dental office. You really do get to know each other really well and just build relationships with everybody. So that's all I had to share as far as the PowerPoint goes, but as, I don't know how I am at. Oh, there you go. Never mind. All right. Technology is not my forte. But so just a little bit about me. I know I should have started with that, but I have been in dentistry for about 10 years and I just started teaching about 3 years ago. So just being able to see the different fields and varieties, it is really beneficial. Dentistry anywhere. If you want to start as an RDA or RDA and like an assistant, go for it. I think that's a great avenue too. If you want to start as hygiene, go for it. I think that they're both really great and they get your feet wet into the dental field. There's shadowing opportunities as well for hygienists. Those are pretty easy to come by. You just call a dental office and they're usually more than willing to let you come by and shadow one of their hygienists, ask them questions and things like that. So I really, again, I appreciate you guys letting me come and talk to you. I hope this helped get some excitement going on for the dental field, along with Joy's presentation, and I'm excited for Dr. Ken's. So I hope reach out. I'll put my email in the chat as well, but I appreciate everything. And if you have any questions, feel free to ask.
Thank you, Lindsay. That was awesome. Again, put your questions in the chat. We'll go over them at the end. All right, so Dr. Fat, you are up next. I think you need to unmute, Dr. Fat.
How's that? Can you hear me? Okay. Anyway, I'm honored to follow these two top professionals in their field. As far as what both Lindsay and Joy said about the dental team, they are so important, at least, and I've experienced this in my own office, that the RDA and the RDH, the hygienist, it is a vital part of the whole experience for the patient. And that's all we're talking about is patient experience as far as delivering the health care that they need and educating them and helping them with their prevention. But it takes a dedicated individual, and you heard from two of the best, I'm sure. So as far as my office is concerned, by the way, when you mentioned Dr. Ken, it made me think of that TV program. And what was the name of it? Anyway, the guy was really a comedian, but his name was Dr. Ken. But my last name is actually Fat, F-A-T. That's even more funny, but that's another story. When they asked me, I was talking to Joy earlier before we signed on, and she said, oh, I said, how long have you been doing this RDA? And she said, Joy, did you say 13 or 15 years or something like that? And you thought that was a long time. And then she asked me how long I've been working as a dentist. And I hesitated. I didn't want to upstage her, but I have to be truthful. I graduated from the dental school in 1964. And I've been practicing from that day and all the way through today. And who knows how long in the future. So what does that tell you? That tells you that I must like it, or I have nowhere else to go, right? So I have a great team in my office. I'm really proud of both my RDAs. In fact, recently I just hired a gal that came out of the, I think down here where I'm in, on Scripps Drive, which is near Campus Commons. She graduated from Carrington, and without any experience, I hired her as an intern. She interned for me for 6 weeks minimum, and then I hired her because she was good. She was dedicated. She had a great attitude, and she wanted to learn more. In the schools, it's very important, like the Faith Institute up here, up there in El Dorado County there. You learn the basics, but as far as the actual experience, you got to have the experience. And if you have the basic knowledge, then most offices are willing to train you gradually until you get very proficient. That's how my present, I have another RDA that is just fantastic. And she came in barely knowing much of anything. Now she's been with me 13 years and the patients just love her. So that's, and my other RDA that I started many years ago, now she's in charge of the front desk. So she worked herself up. She knew everything that we do in the back. And when an opening came up in the front administration area, she was willing to shift over there, and she's invaluable because she knows the business part of it. She knows insurance, and she knew what the patients were going through, so she could fill in between. And then I have a hygienist. She's been with me now 21 years. She's just great. The patients love seeing her and request her every time. And like both Joy and Lindsay mentioned, if you create this family environment and they see familiar faces, and these faces are very proficient, they're very professional, they know what they're doing, and as well as they have a great attitude, it really makes the office so pleasant to work in for everybody involved. And that's why I'm in practice for that long. I remember when I went out to, I graduated from dental school in 1964. And I announced to my classmates, I said, well, I'm going to only practice for 5 years. That's plenty of time. And I'm going to quit, right? Well, at 25 years, reality sets in and said, well, you got to educate your kids. You got tuition for them. You got still house payments. You got car payments, and you got to live. So that extended my time. Anyway, I probably didn't have to work as long, but then it became a pleasure once I overcame a lot of the, when you're starting any business or any office, there are challenges, whether it's in HR or human resources, finding staff, dealing with patients and learning techniques, all that transpires. But after, you go look at the whole picture, and that's part of that's the price we pay, And if you stick with it and you do, you're dedicated to helping the patients, that's your primary goal, then it's going to be a pleasure. Right now, not only do I have a great staff, but I have working with me my daughter-in-law who graduated from the UOP Dental School, and now her daughter, which is my granddaughter, and we have 3 generations of dentists in my office. So am I going to retire? Why should I? Everything's fun. And just to give another shout out for this profession, because it's been good for me. It's good. I've been able to provide for my family. Of course, you don't get rich doing this. So if you're thinking you're going to hit the jackpot staying in dentistry, forget it. There's too many expenses. But it's really has been a joy and a pleasure. I have, like I said, I have 3 generations of doctors working in my family in the same office. But what was more pleasurable is I have one family that has 5 generations coming to me. I've seen the great grandparents, and now I'm seeing the little children. That's what the joy of dentistry is about. Also, it's a great profession because not only is this a personal connection that you make with all these patients for so many years, but it's a progressive field. You'd think that, well, everybody comes in, they hate coming to the dentist, and you're the bad guy and all that. But like both Joy and Lindsay had mentioned before, you have the ability to convert them into real dedicated patients that really appreciate what you're doing for them and keeping their health, especially when we see patients that are older. Like just last week, I saw this man. Let's see, I think he was only in the late 40s. He didn't take care of his teeth. He lost all of his upper teeth and most of his lowers. And so we had no choice but to build him a full upper denture and a partial lower denture, false teeth. Now, I was telling him, it's too bad I didn't get a hold of you, about 20 years earlier and had you go on the correct path, and he would have avoided this. So, and most of the patients were able to do that, but every once in a while we still see this, and it does break our hearts to do that, but at least we're still able to provide service. And speaking of the progressiveness of this field, that's why it always gets me excited to go to these meetings and get continuing education. There's so much change and progress. I mean, now before we'd have to take out teeth and build these bridges and removable devices. Now we've got implants and things that simulate the natural teeth and it doesn't get dislodged when they're eating. We have, we just recently, thank you to my granddaughter who graduated last year from UOP. She convinced me to invest into a scanner. A scanner is a device that, well, anyway, what she's doing for the patients now is providing Invisalign. That's an orthodontic treatment. And with the same scanner, I'm able to scan to make copies of the patient's mouth if we're preparing for a crown or something, rather than doing the old traditional impression technique. I'm sure this is all strange stuff to you, but anyway, is progress. Every year there's progress. We have digital x-rays that you saw that Lindsay presented on her PowerPoint, and there's always innovations. Unfortunately, it costs a lot of money, so that's why I'm still working. I had to pay for it, but it's a pleasure to be involved with this change and this progress. In addition, we have what I enjoy about being a member of this association, the American Dental Association, is, the first and foremost goal is to improve the oral health of patients. And so then they have programs, and like I said, the meetings, the annual meetings and the state meetings and all that, I go to them all the time because you learn something. You're learning the latest techniques and the latest equipment, and so it's not a thing that doesn't move along. So anyway, and they select a real nice place for you to meet. I like the one that is in Hawaii, for example. So we have a great association. As far as the economics is concerned, I think it's something that you can, first of all, dental school is expensive. There's no doubt about it. The private schools are even more expensive. But the trade-off is, you earn a good living, you'll be able to pay off your loans, and there are programs or grants and scholarships and other programs that help you defray some of these costs. And if you're lucky, you could, some of my friends actually, when they graduated, they joined the armed forces. And if you join it and commit yourself to practicing for that particular service for 2 or 3 years, then they will pay for your education. So that's another route that is available. But in my case, I came out right from graduation and I had to go to the bank and borrow money. So, and I borrowed money not to pay for my education because I was lucky my parents paid for my education. So I didn't have to worry about that, but I had to borrow money to open my office. So it took me 7 years to pay off that. That was, at that time, it seemed like it was impossible. It was formidable, but it can be done. I don't want to discourage you. If you think that this is your field, go for it. I think it's a wonderful field for you, and I got to commend you for the students there, all your juniors and seniors in high school, that look this far forward and start exploring the various opportunities that you might have. That takes a lot of foresight for you, and I congratulate you for joining this session that the Medical Society has put on. I think it's invaluable, and thank you for inviting me.
Thank you, Dr. Fatt. So quick question for you. After you graduated from high school, how long did it take and what steps did you take from high school to becoming a dentist in private practice? Okay, so from high school, which you kids are in now, so you're going to get probably, most schools now require a 4-year degree. So you're going to have to be in a science
degree, like biology or something like that. Same with medical school, you have to have 4 years of that and show your degree. Then you make your application, and for dentistry, there's a DAT, which you have to take, and shows your aptitude towards it. And there's an admissions requirement. And I don't think they have a practical anymore, but in those old days, it used to have test your skills with your hands. And but now I think it's all didactic. And then, so you take that, and then if you're accepted, then you go into, most programs are 4-year programs if you're going to come out as a general dentist. If you're lucky enough, or if you want to specialize, as Lindsay had mentioned, in periodontics or some of the other specialties, that's an additional two years. Both my other children, one's an endodontist, so he went to Michigan after he came out of general dentistry training, got his degree, and then he had to work a year. So he worked a year in my office and then applied for endodontic training, and he went to Michigan for 3 more years. And my other child, Diana, is a prosthodontist. So she did the same thing. I was expecting her to be, since my oldest son didn't want to be my associate and take over the practice, then she came along. I said, oh, good, you're going to take over. Well, and she decided to go into prosthodontist. I said, wait a minute, who's going to run my office after I leave? And then, of course, my son solved the problem. He says, I got a solution for you. My wife, who is Dr. Char, who is presently my associate here. And so everything worked out. And but the prosthodontic training was an extra 2 or 3 years also. She had to go to LSU. So they both have their own practices in town, and I'm proud of them. And so the profession has been good, and I would highly recommend it for those who would be interested. And if you want to shadow anybody, come to my office, give us a call, and be glad to show you around and help you kids determine what you want for your future.
That's wonderful. Thank you, Dr. Fatt. So we'll be sure to share your information with the students in a follow-up email. I just wanted to mention, because I heard the word scholarship a couple of times, there are scholarships available for those that are interested in pursuing their degree in dentistry and becoming a general dentist. There is a society, just like the medical society, we represent physicians, but there's the Sacramento Dental Society, and they can help connect students with scholarships that are available to them as well. And just wanted to mention for any of the students on today that are interested in becoming either physicians or dentists, there is a scholarship, and I hope it's still available by the time you get there. It's called Cal Health Cares, and it's a loan repayment program for up to $300,000 for a loan. And in exchange, the physicians and dentists that are chosen, and there's usually 2 or 3 chosen, both dentists and physicians from the Sacramento area for all of California, as long as they agree to see Medi-Cal patients for up to 5 years, they're eligible for this loan repayment program. So there's always a way to pay for the education that you need. If you're interested in the career, you'll find a way to do it. I guarantee it, especially all of you that are on here today. I mean, obviously you're really serious about finding your careers, certainly much earlier in life than I did. When I was a junior or a senior, I certainly wasn't doing a program like this. So again, I agree with Dr. Fatt. Kudos to all of you for participating. So students, if you have any more questions, feel free to email the panelists directly and ask those questions. We're going to take just a short 4-minute break. I'm actually giving you a break today. before our next presentation on emergency services and the different careers that you can pursue. And students, help me please thank Lindsay, Dr. Fat, and Joy for taking the time to speak to all of you today. Thank you so much to all of our presenters. We really appreciate you.